Recently, there has become a new emphasis on the opioid crisis, not only on overprescribing, but with distributors sending too much to pharmacists, and from manufacturers sending too much to the middleman or the distributors. And there are going to be lawsuits that are going to really impact exactly how we use the opioids. So I would like to take a few minutes and share how, when I was in practice, how I avoided the opioid crisis by the use of several products and medications which we will discuss, or which I will discuss on this video. First of all, my standard anesthetic for doing my periodontal surgery for many, many years was xylocaine with epinephrine, and it worked quite well. And as an analgesic, I would use Emprin with codeine, which was aspirin with codeine, but unfortunately the aspirin did precipitate a little post-operative bleeding. Sometimes, on some occasions, it became quite annoying to the patient. And with the codeine, we saw some level of nausea. But the epiphany in my practice came with the advent of Marcaine. Marcaine is absolutely fantastic. And when I began to incorporate that in my practice, I was able to modify not only the pain medications that I use, but the way I use those medications. The beautiful thing about Marcaine, it tends to last 6 to 8 to 12 hours depending on the patient and their metabolism. And here is the way that I use that. I continued to do my surgery under xylocaine with epinephrine if there was not any contraindication to that. But once I was through the surgery, through suturing and so forth, then I would go in and completely anesthetize the mouth with Marcaine, including blocks in the mandibular arch. The beautiful thing, as I said earlier, is Marcaine will last anywhere from 6 to 8, perhaps 12 hours. By the time I started using Marcaine, my analgesic of choice was no longer Emprin 3 or Emprin with codeine, but now I was using Aleve, which is naproxen sodium. Now, certainly you can use an ibuprofen, and the most common ibuprofen is Advil. And depending on what you read in the literature, these two medications, the ibuprofen or the Advil, will last anywhere from 4 to 6 hours. The beautiful thing about naproxen sodium or Aleve is this will last, we know, at least 6 to 8 hours, and in some cases, depending on the patient's metabolism, up to 12 hours. And because of that, as soon as the surgery was over, we would have the patient bring some Aleve with them. That's naproxen sodium. And we would give them an Aleve. But here is an important factor that you need to know, not only with Aleve, but with all medications. If you take a medication on an empty stomach, the stomach does not realize that there's any medication there. And the medication can just dissolve and rest in the stomach, and maybe even irritate the lining of the stomach. It's very important that you ingest something to distend the stomach, to let the stomach know that there's something there that needs to be absorbed. So given that, after we finish the surgery, we would typically give the patients a glass of orange juice to drink, not only to distend the stomach, but also to elevate the blood sugar, because sometimes our surgeries took 2 and 3 hours. So we put something in the stomach. Some patients would bring ice cream with them or something like that, but something that would distend the stomach. That was very important. Now, other medications that you can use are ibuprofen. The most common form of ibuprofen is Advil. And if you look at the literature, these two do not last quite as long as as Aleve lasts. They talk in terms of 4 to 6 hours, where naproxen sodium or Aleve will last considerably longer. At the pre-surgical appointment, our dental assistants were trained to spend significant time to reassure the patient and to explain our protocol for controlling pain and swelling. This all began with, as I said, the use of Marcaine. Marcaine will keep the patient anesthetized anywhere from 6 to 8, perhaps 12 hours, depending on the metabolism of the patient. So after we have completed the surgery, suturing and so forth, I would go in and completely renumb the mouth with the Marcaine, and this would include bilateral mandibular blocks. The patient was then instructed to bring some Aleve with them, and they were given them Aleve at that time, and were given a glass of orange juice to distend the stomach, as we have mentioned, and to also elevate their blood sugar, because they've had nothing to eat for a considerable amount of time before the surgery. They were then instructed 4 hours after the surgery to take the second Aleve. We know fully that that first Aleve is still in their system. Remember at that time to eat something to distend their stomach. 4 hours later, we are now 8 hours after the surgery, they were instructed to take the second Aleve. Eat something, get something in their stomach. 4 hours later, which is 12 hours after the surgery, they were to take the final Aleve, which in that case is going to last 6 to 8 hours. So we are basically keeping the patient free of pain for almost 24 hours. The other thing that I did, and I learned this from one of my dental assistants, Margie Goza, I used to call the patient the night of surgery to see how they were getting along, or how they had gotten along. Many were groggy. So Margie suggested that we wait until the next morning, somewhere around 10 o'clock, when the patient was fully aware, to see how they were getting along. And it was always so reassuring to hear the patient talk about how well they had gotten along, so forth and so on. So this protocol does work. What we do is spend some significant time preoperatively explaining to the patient exactly what we're going to do to prevent them having pain. And that's exactly the formula or the protocol that I have described for you. Also, you will note that when we do surgery, if there is swelling, there's soreness and pain. So if there's not a contraindication to it, the use of steroids can be of great benefit in taking some of the soreness out. And for those of you that are using IV anesthetics, you can add some steroid solution to that. Now typically, I did not necessarily use IV sedation on every surgery, so therefore we used the Medrol dose pack, which if the surgery was in the morning, we would have them start the Medrol dose pack the night before. If the surgery was going to be in the afternoon, then we would start the Medrol dose pack in the morning. In any event, they would have a good sized dose of steroid in their system before we began the surgery, and this prevented a lot of post-op swelling, which does contribute to the soreness and tenderness of the procedure. Before we were so aware of the opioid crisis, I would give patients written prescriptions, and often one prescription would have several different medications on it. Now, if I were doing that, I would not use written prescriptions, but phone in those prescriptions to the pharmacist. I think it is evident that in the future that pharmacies are going to be tracking the consumption and distribution of controlled substances, and I'd like to congratulate the state of Kentucky because they have started a pilot program called CASPER, K-A-S-P-E-R, where they are tracking controlled substances, and I think this pilot program is going to, in all probability, spread into the entire country. The patient sometimes is a little skeptical. So because of that, I would not hesitate to phone in a minimum dose, 4 to 6 tablets of some type of opioid, so the patient would have that in case they were a little apprehensive. Because although we assure patients that they're not going to have any pain, still there's some doubt in their mind. But if you say give them 4 or 6 tablets of something and not allow that to be refilled, then there's very little likelihood that they would become addicted to that. And if they are demanding and want more medications, in all possibility, you're dealing with someone who's already addicted, and do you really want that type of patient in your practice? So hopefully following this protocol will give you some ideas which will help you avoid participating in the opioid crisis, where we can save lives yet control pain. So enjoy.